1,
2, 3,
4, 5,
6,
7, 8,
9,
10, 11,
12.
13.
Imagine this, every day. Your mood suddenly changes at any given moment, and you can't seem to control it. You almost feel like there is nothing you can do about it, and then you find out that there may be a reason why it's happening to you. You go to your doctor, who examines you, and tells you that you have bipolar disorder. You might be questioning, what's bipolar disorder? According to WebMD.com, bipolar disorder is a mental illness that causes a person to experience manic episodes or depressive stages. This makes it hard to manage, let alone live with. I know this because I was diagnosed bipolar. According to MayoClinic.com, medical doctor David E. Larson stated that a person would normally be diagnosed bipolar between the ages of 15 to 25. However, I was diagnosed bipolar at 7 years old. Dr. David E. Larson also stated that this disorder is similar to the diagnosis of depression, which makes it a difficult disorder to diagnose, especially at a young age. There are 3 different levels of this disorder. However, the most common level of the disorder, according to an article on WebMD.com, would be the 2nd level. Before you can look for symptoms, it is imperative to know what a person with level 2 disorder will experience on a daily basis. As stated by the U.S. National Library of Medicine, those with the 2nd level of bipolar disorder have never had full mania, which is described by Dr. David E. Larson as abnormally elevated or irritated mood, arousal, and energy levels. But they experience hypermanic episodes, which include high levels of energy and irritable moods constantly. They also alternate with periods of depression. The experience of this disorder can be seen less complicated when you know the symptoms. According to WebMD.com, one phase of this level is known as the manic phase, and the symptoms include easy distraction, hyperactivity throughout the day, and a little need for sleep. And that person would most likely be the life of the party, and they will also experience erratic and unhealthy behaviors. People in hypomanic episodes might spend money that they don't have, seek out sex with people they normally wouldn't, and engage in other impulsive and risky behaviors. When a person has this level of the disorder, it is hard for them to notice any changes in themselves if they have always been this way. It is easier to notice that there may be an underlying problem when they experience the depressive stage. The depressive stage has many different symptoms. The depressive symptoms of bipolar disorder can last weeks, months, and rarely even years. The symptoms include daily low moods or sadness, fatigue or lack of energy, feeling worthless and helpless, loss of pleasure in activities that were once enjoyed, thoughts of death and suicide, and pulling away from friends. Now, after learning the symptoms, there are various ways for treating this disorder. According to Cohen Dimitriani, as stated in his book, Bipolar Disorder and Mood Stabilization, Standing at the Crossroads, one effective way for treating this disorder would be the use of mood stabilizers. Some examples would be epital, lamictal, lithium, and valproic acid. Another would be taking anti-anxiety pills. An example would be Valium, or you can take an antidepressant, one being Prozac. The last treatment for this disorder would be therapy. The first would be the electroconvulsive therapy, also known as ECT, which uses electric currents to treat depression. The second would be transcranial magnetic stimulation, also known as TMS, which uses high-frequency magnetic pulses to target the areas of the brains that are associated with the disorder. This is usually used after the electroconvulsive therapy, ECT. The third would be support groups. An example would be Jennifer Shortell's Depression and Bipolar Support Alliance. A support group participant said, "Knowing that I wasn't going through this alone, that was my first breakthrough." This proves that support groups can be effective in helping with the struggles of the disorder. Bipolar disorder level 2 is a difficult disorder to live with and manage alone. It's important to know the experiences a person undergoes when they have this disorder, the symptoms associated with the disorder, and the treatments that prove to be effective for treating this disorder. Now that all of these have become clear, this gives you the chance to change someone's life who is dealing with this disorder.